Well, as the days get shorter and colder and holiday gatherings get larger, the general public is more at risk of getting sick. This time around, health officials at home and abroad are warning of the triple threat, which refers to 3 different diseases spreading through communities. Our Tyler Simnet has the details tonight in this developing report.
COVID-19 infections, seasonal influenza, and cases of RSV are all trending up, with health officials sounding the alarm for a triple threat as we enter this holiday season. Officials from the Pan American Health Organization reveal these 3 infections are already burdening healthcare systems in the region and warn the public to be vigilant.
Seasonal influenza are increasing, following 2 years of below average activity. Flu activity in the northern subregion is rising, as expected around this time of year. However, cases appear to be rising earlier than usual in places like the United States and Mexico. At the same time, we are also facing RSV, a common seasonal virus. After a couple years of lower seasonal transmission, RSV infections have increased significantly. The rise of a single respiratory infection is a cause for concern. But when 2 or 3 start impacting a population concurrently, this should put us all on alert.
Director of the National HIV/AIDS and Infectious Disease Program, Dr. Nikia Forbes, reveals that if you're not careful, it's possible to be infected with all of these illnesses at once.
It is possible that one could have the virus that causes COVID, that's SARS-CoV-2, and the flu, the influenza virus. And then there are other respiratory viruses that cause flu-like symptoms or cough. And so the third threat would be the respiratory syncytial virus. And so there are cases where people could be, we call it co-infected. They could have 2 or more of those viruses. And there was a case where someone had 3 of those viruses and they passed away from it. And so it's something to keep in mind.
And despite this triple threat, there are protection measures the public can put in place.
So there are things that persons can do to protect themselves from COVID and influenza virus and even respiratory viruses at large. And so COVID-19, there are available vaccines. That's the flu vaccine. The flu vaccine is something that is recommended annually. Anyone over the age of 6 months and up is eligible for a flu vaccine. So I definitely would recommend flu vaccination as well. And then all the other preventative measures that we heard so much about in COVID, hand washing, if you're sick, stay home, if you're coughing, try and cover your cough, and hand hygiene, all of those things will be helpful to reduce the chance of getting those respiratory viruses.
Tyler Simnet, Eyewitness News.